Stepped care is an evidence-based, staged approach to delivering mental health services. The stepped care model means matching treatment to a person's needs, from the least to the most intensive. The aim of the stepped care model is to support people to access the right services for their needs at the right time. It allows people to step up and step down to different levels of care as they move along their recovery journey. For example, a person might be experiencing anxiety symptoms related to a changed home situation. The initial support required might be to access psychological therapy sessions with a mental health clinician in the moderate step. As the person learns strategies to help manage their anxiety, their support needs may reduce. The person and the mental health clinician can then discuss stepping down to a web-based support program that the person can self-manage. Assessing needs and level of care. Mental health problems can be complex. There are differences in symptoms and how each person responds to different treatment options. However, as with a physical illness, a person with a mental health condition will benefit from the right treatment and support. An initial assessment helps understand a person's needs across different areas of their life. A comprehensive assessment can help to link a person with the right support services. Referral options and process for non-acute needs, mild moderate needs, or severe complex that can be managed in community. If a person's needs are non-acute and can be managed in the community, the best place to start is with the person's usual general practitioner or GP. The GP will assess a person's physical and mental health needs and can help a person connect to a range of support services. The GP may also suggest linking with social or community programs. Booking a long appointment is recommended to allow enough time. The GP might also ask the person to return for follow-up appointments. It can be helpful to have a natural support person also attend the appointment and to take identification, Medicare card and any pension cards. A mental health treatment plan may be completed during the GP appointment. This plan should include a summary of the person's support needs and the recommended treatment service, such as a psychologist or arts therapist. The person is entitled to a copy of this plan. The plan might be required to access some programs, such as Medicare Better Access to Mental Health. If the person doesn't have a usual GP, they may need help finding one. Some general practices use a website to list their doctors and specific skills or interest areas, such as mental health. It can be frustrating if it is difficult to refer to a service. Some services are publicly funded, which means the state or Commonwealth government allocates public money to the organisation to deliver the program. Other services are privately funded through a direct fee for service. Many services have waiting lists. Here are some options that may help if the local mental health service is not taking on new clients. Try talking to the service about your concerns and ask if there is any other solution they can suggest. 2. If you're not happy with the response from the service, you can provide feedback to the GP or initial contact person who recommended the service. They may be able to suggest an alternative and/or help with a warm referral. Referral options and process for acute or complex needs that cannot be managed in community. If a person's needs are acute or a complex presentation, you can consider a referral to the Child and Youth Mental Health Service at La Trobe Regional Hospital. It is important to understand the eligibility criteria for this program. The person must be a resident of Gippsland, aged up to 18 years with a diagnosis or suspected psychiatric diagnosis requiring intervention. It must be a complex presentation necessitating thorough mental health assessment and diagnostic clarification, and where presentation cannot be managed within the community, or an acute mental illness which poses significant risk to self or others. They can help with assessment and treatment of severe and complex mental health, community clinical case management, and evidence-based therapeutic interventions. Family and systemic interventions as primary focus. The referral pathway is consent from legal guardian, Call LRH Mental Health Triage 1300 363 322. Speak with triage clinician. Intake clinician will contact referrer, parent, legal guardian to discuss and clarify suitability of referral, appointment or alternative pathway offered. If things change while waiting for an appointment. Things change all the time. Sometimes a person's mental health support needs change while waiting for an appointment. It is a good idea to remember these options if a person's needs increase or become more complex or urgent. 1. If a life-threatening emergency, phone for an ambulance on 000. 2. Consider contacting a crisis support line for advice, such as Lifeline on 131114 or Suicide Support Line on 1300 651 251. Indigenous services. If a person identifies as Aboriginal and/or Torres Strait Islander, it could be an option to access an Indigenous health service. There are 5 Aboriginal community-controlled organisations that deliver health services across Gippsland. Getting more information or guidance. There are many websites that provide information about mental health and well-being, including tips and strategies where a person can learn while waiting for an appointment or at the same time as accessing a clinical service.